is Dr. Orry Erez, orthopedic surgeon, specializing in joint reconstruction and sports medicine surgery at Maimonides Medical Center. I started my medical training at the University of Michigan Medical School, then progressed onto a residency at Henry Ford Hospital. That's in Detroit, Michigan. After that time, I then moved on to a fellowship at Lenox Hill Hospital in New York City. I specialized in joint reconstruction and sports medicine at that point in time, with some of the pioneers of joint replacement as well as sports medicine. So my specialty in orthopedics is hip and knee replacement as well as sports medicine. I also have a very keen interest within orthopedics on joint reconstruction. So the two major joints that I deal with are the hip joint and the knee joint. After a patient has attempted every type of conservative treatment, we usually move on to joint reconstruction. So within joint reconstruction, we're actually taking out all of the diseased bone, or the bone that is no longer functioning, and we actually need to cut it out and put something new in there. The technology has changed over the course of years. Right now we're using mostly metal and plastic, although in younger, more active patients, the newer technology is ceramic, and we've used that as well in patients at Maimonides Medical Center. The process usually is about 2 to 3 hours of an operation. Patient usually stays in the hospital for about 3 days, and they can go home or to rehab. After rehab, patients are usually sent home for more physical therapy. It tends to be a process that can last up to 6 to 12 weeks, but patients are walking much better than they were prior to surgery within 6 to 8 weeks. Every patient has multiple different facets to them. It's important to see them not just as a disease, but also as a person. So within that, I like to find out what the goals are for a patient, where they want to be, and how I can help them along to get to that position. Whether it is non-operative treatment or operative treatment, those are both options, and not every patient is ready for surgery at the point in time when I see them. There have been a number of newer trends within orthopedics: smaller incisions, minimally invasive surgery. Within my scope of practice, I try to do arthroscopy, which is using small puncture holes and a camera within a joint to see what's going on and treat a problem. We also try to prevent early joint reconstructions, and because of that, we try to treat it with a sports medicine physician. The Maimonides Bone and Joint Center in itself is a fully functional orthopedic practice. It has one of every type of specialty. There's nothing that is not found within orthopedics. So it's a one-stop shop that can combine both neurology, rheumatology, orthopedics, and even physical therapy. And that will allow a patient to not have to go to multiple different locations at the inconvenience of that patient and get the best treatment in one place. Truthfully, every day it seems to be a great day. Anytime that you have a patient coming in that you did a hip or a knee replacement and they were able to walk within a couple of weeks of doing the reconstruction, and prior to that they were unable to walk, it's a very rewarding moment, and it's definitely an achievement every time you help that person.